Can you hear me? Okay. Just a disclaimer that this webinar will be recorded for others to view. Thank you for being here live. Meet the Milk Bank. Welcome to today's webinar. My name is Titina Sanders Bay, and I am here today with the Mother's Milk Bank of the Western Great Lakes. We are hosting today in partnership with the Nutrition, Obesity, and Health Equity Research Group of the University of Illinois at Chicago. All participants from today's webinar will receive a certificate of attendance. Application for continuing education recognition points have been submitted to the International Board of Lactation Consultant Examiners. We will also be applying for credits for CLCs and CLSs at the end of the webinar. We will share a link to a post-webinar survey. We appreciate feedback that will help us continue to improve upon our presentations. Those who submit the survey will be entered into a raffle to win a $25 gift card and a Milk Bank WGL goodie bag. Today's objectives include identifying 3 measures the milk bank takes to ensure the safety of donor milk. Identify, I'm gonna cut my camera off because seeing myself is making me nervous. Identify 2 indications for donor milk use in the hospital and outpatient settings. List 2 steps milk banks take to increase access and promote the equity of donor milk. I'm going to introduce our presenters. I am Titina Sanders Bay, Community Engagement Program Manager, the Milk Bank WGL. I am a doula, I'm a certified lactation counselor, and I have more than 20 years of experience working with families as a doula, childbirth educator, and lactation counselor. Nicole is our education manager. She has a bachelor's of science in nutrition, and she's also a certified lactation specialist. Jenny is the relationship manager at Milk Bank WGL, and she has over 10 years of public health experience, including direct care and administration. She is a nurse and a former doula. Summer, our executive director, will be monitoring the chat today. She is a former NICU nurse who established First Donor Milk Program in Illinois, in addition to leading our organization. She serves in leadership roles with national accrediting organizations. Summer will be available in the chat to answer your questions or direct your questions at the end of the presentation. Our board of directors are a mix of professionals from Wisconsin and Illinois. I'd like to introduce Dr. Odom Young for UIC, and thank you for joining us today.
Thank you so much, Titina. We're really excited about co-hosting the webinar today. And also we want to give a shout out to Health Connect One and Sadie for helping support and facilitate the registration and also the webinar platform. I'm Angela Odoms Young. I'm an associate professor in kinesiology and nutrition and also director of the Nutrition, Obesity, and Health Equity Research Group. And I've known Titina, I don't know for how many years, and she introduced us to the work of the Milk Bank. And so we really wanted to bring the information about donor milk to the community more broadly, particularly communities of color. and support both breastfeeding as well as access to donor milk in those communities. So I'm going to turn it over back to Titina, and I'm just excited to be here. We want to welcome everybody, and we are just honored to be a part of this and humbled. And so thank you so much for inviting us also to collaborate. And I forgot one shout out. I know Marjorie and our staff at NOHE, we call it NOHE. And I just want to also give a shout out to them and let them know how much we appreciate their assistance in this endeavor. So I'm going to turn it back over to you, Titina.
Thank you. Thank you, Dr. Odoms-Young, and the entire team for your support in hosting us. I'm actually going to pass the torch now to our education manager, Nicole.
All right. Hi, everyone. My name is Nicole, and I'm the education manager at the Milk Bank. My main roles are to assist hospitals in setting up their donor milk programs, establish milk depots and donor milk dispensaries, and also provide education about donor milk and human milk banking. Before I dive into talking about the Milk Bank, let me share a little bit about my background. So I was born and raised in Milwaukee, Wisconsin, where I received a bachelor's of science in nutrition from the University of Wisconsin-Milwaukee. I completed my senior year nutrition internship with the lactation department at the Children's Hospital of Wisconsin, which is where I became passionate about human milk. And then after graduating in the spring of 2018, I moved to Illinois, where I completed my certified lactation specialist course and starting at the Milk Bank. And this is a picture of me and my bunny Thumper. That is us on our graduation day. And if you look closely, he's wearing a little graduation cap too. Now let's talk about the Milk Bank. So the Mother's Milk Bank of the Western Great Lakes is Wisconsin and Illinois' only Himbana accredited nonprofit milk bank. We provide pasteurized donor human milk to premature and critically ill babies, support moms who donate milk after loss, and distribute reduced cost or free donor milk to low-income outpatients who demonstrate a medical need for donor milk. Himbana stands for the Human Milk Banking Association of North America. It's quite the mouthful. Himbana milk banks are nonprofit operations that follow internationally recognized guidelines for milk banking. Himbana nonprofit milk banks are mission driven. It is so much more than dispensing milk for us. We promote breastfeeding. We are active and support our local communities. We continue to educate ourselves to support our donors, recipients, and partnering hospitals. And our nonprofit status ensures that no one profits from the distribution of human milk. And our net proceeds are actually reinvested into our community, like our charity care and bereavement programs, which is actually a part of the integrative milk banking model that we follow, which we will learn about in a minute. So Himbana currently has 30 nonprofit milk bank members and 4 developing milk banks right now. We are the Wisconsin-Illinois Milk Bank, and we are located in Elk Grove Village, Illinois, right by O'Hare Airport. And if you are not located in our region, you can find your local milk bank by visiting Himbana's website. They have a Find a Milk Bank page. And Summer will provide that link in the chat box for you to view. Now we will learn about PATH's integrated human milk banking model. So PATH is a global nonprofit improving public health around the world. They created this really cool framework model for global milk banking, and it is community focused and has breastfeeding at the center. These are the 4 steps, and it is a very comprehensive program for milk banks to run safely and ethically. As a part of the public health community, we are proud to follow the integrative human milk banking model. Most of our milk banks or milk depots are located in centers that offer breastfeeding support. We're always working to increase access to donor milk through our donor milk dispensary network, charity care program, insurance billing, and our donor milk equity program. We also offer bereavement support, education, and are very involved with our community partnerships. So what is donor milk? Pasteurized donor human milk is human milk expressed by a screened donor that is pasteurized by a Himbana accredited milk bank. It's tested for safety and distributed to inpatients and outpatients. Some key points are that our milk is batched gestationally, which we are one of few milk banks that do this, and our milk is gently pasteurized and tested for drugs and bacteria. I will talk more about our safety measures and screening processes later in the presentation. So when it comes to infant feeding, we really only have two choices, human milk and formula. For human milk, mom's milk is definitely the healthiest feeding choice. Mom's milk develops baby's immune system, promotes a healthy microbiome, and is tailored for her own baby. The next best choice, if we don't have access to mom's own milk, is pasteurized donor milk. There are some changes to donor milk due to pasteurization, and there are access issues as well, which Titina will touch on later in the presentation. Some families milk share with either friends or a relative, and there are varying levels of risk. There's also milk selling, which has a significant risk. And if families don't have access to human milk, the other choice is formula. So formula is based either with cow milk, soybeans, or other agricultural commodities, and has lots of ingredients from multiple sources. And we know that there are health implications with formula, like the risk of infection, disease, microbiome disruption, and other implications that we don't even understand. Informal milk sharing is when one mom shares milk with another family. No money is exchanged, and this milk is not pasteurized or screened by a milk bank. Generally speaking, moms do this to help families in their community. And you can think of milk sharing as a continuum with varying levels of risk that depend on the health status of the baby and the mom sharing the milk. If it's a sister or a really close friend, we may perceive the risk to be low compared to sharing with a stranger. And in reality, we may not know all of the risk, and every circumstance is unique. We do not recommend milk sharing in the NICU setting since these infants are so fragile, and we always encourage families that are considering milk sharing to check with their infant's provider to assess the risk and to help with decision-making. So the FDA does provide some guidance on using human milk other than mom's own milk. Their official recommendation is to not use milk directly from individuals or from the internet. They identify the possible risks of chemical contamination or disease transmission. And the FDA recommends consulting with a healthcare provider and using milk from a source that screens their donors and has measures in place to ensure the safety of the milk. The FDA actually lists Himbana as a source to get more information. And we really want to emphasize not to purchase milk on the internet. Research shows that this milk could be mixed with cow's milk or water, or be contaminated with harmful bacteria. There are also for-profit companies that sell human milk, usually directly to hospitals. And I want to break down the differences between Himbana nonprofit milk banks and for-profit companies. So in terms of safety and regulations, nonprofit milk banks are required to be registered with the FDA and are accredited by Himbana. Himbana is very transparent about our safety measures, and our public standards are actually available for anyone to view on Himbana's website. Nonprofit milk banks also use the Holder method of pasteurization, which is gentle on the milk and retains important bioactive factors. On the other hand, for-profit companies are not accredited and have varying safety measures, depending on the company. They also use the retort method of pasteurization, which results in a shelf-stable product with a significant loss of antibodies. And in terms of the business structures, Himbana nonprofit milk banks follow the integrative milk banking model, which we learned about before, putting breastfeeding and the community first. And all of our net proceeds are invested into our research, safety, and community programs. On the other hand, for-profit companies distribute a portion of net proceeds to shareholders and owners. And this is a snapshot of what we are preparing for our audit next week. This is based on the food safety framework provided by the FDA and the Canadian Food Inspection Agency. The Food Safety Modernization Act shifted our focus to prevention. So we have 2 PCQIs, or Certified Preventative Controls Quality Individuals, that maintain our food safety plan. They identify hazards and preventive controls to mitigate risk. And we also have very strict critical limits for pasteurization and donor blood screening. And for those that work in the hospital, accreditation for us is similar to the Joint Commission visiting your hospital. So the milk bank is heavily regulated by the FDA, the Illinois Department of Public Health, and also the Elk Grove Village Health Department. We have many safety measures and regulations in place, as you've learned, and to make sure that the milk we dispense is very safe. About 75% of the milk we dispense goes to hospitals, and a large portion of that is actually used in the NICU for very fragile infants. So here are some of the safety measures in place. Pasteurization and the donor blood testing are underlined, since they are our critical controls and are very closely regulated by the FDA and HIMBANA. And many of the safety measures we have are in place within our donor screening process, which Ginny is going to talk about next.
Hi, I'm Ginny Hogarth. I'm the Relationship Manager here at Milk Bank WGL. Before discussing milk donors, I'm going to share a brief background about myself. I'm a mother with 2 breastfed children, plus a first trimester loss in between, and this interest led me to several years serving as a doula, childbirth educator, midwifery student, and doula program administrator. Prior to this position, I worked in healthcare administration at a federally qualified health center, which included 3 years as their birth center manager. I'm a recent nursing graduate with a longtime advocate for parent-child health and health equity, and I have a particular affinity for bereavement support. As such, I consider myself a public health nurse, which makes the milk bank a natural fit for me here. This brings me back to the topic at hand, milk donors. Milk donors are the reason we can do what we do. As of last month, we have worked with over 2,500 milk donors. In my opinion, working with donors is one of the most joyous aspects of working at the Milk Bank WGL. Our donors are exceedingly generous, and they are truly superheroes, as you can see in the photo here. They spend countless hours pumping, preparing milk for donation, and working with our donor screening team. In their efforts, they are promoting human milk as an important first food. Donors validate that human milk really is so precious. Donors choose to share their milk for a variety of reasons. Some may have an oversupply, and some may have been surrogates. And similarly, some may have an abundance of milk because their child was premature or is hospitalized. Sadly, some donors have lost their babies during pregnancy, birth, or after, and Titina is going to highlight our bereavement program later on in this presentation. And some babies may refuse their mother's milk due to food allergies or other intolerances. And many families choose to donate because they are deeply committed to our mission. Maybe they had a child that received donor milk themselves, or they believe strongly in the therapeutic value of milk. Lastly, in combination with any of these above reasons, donors might just be out of freezer space. Lactation and milk donation is a highly personal decision. For this reason, we do not solicit milk donors. Instead, we provide outreach and education to ensure families know that this is an option. At all times, we want donation to be a decision that comes from the donor's heart. Similarly, we do not compensate donors for milk. This is an intentional choice that is practiced by all nonprofit milk banks. This better supports the family and creates a safer product. You can see in the slide here that each donor may have a different intention for milk donation as well as a different journey, but it is an almost universal experience for the donor to feel pride in their donation as they know that it will make an impact. We ask that donors commit to a first drop-off of 150 ounces, but subsequent drop-offs can include as much or as little milk as they'd like. There is no minimum amount required for bereaved families. We accept milk that is up to 9 months old, and this gives us time to receive, process, and distribute the milk before it expires. As Nicole alluded to before, the most important aspect of donor screening process is its capacity for ensuring safety. Because the process is so thorough, it can take about 2 to 4 weeks. I'd like to walk you through the donor screening process from start to finish. The process starts with a donor interest form, a simple online form. Summer can paste this link into the chat. We call back interested donors in order to complete a 10 to 15 minute phone screening. During the pre-screen, we ask about the person's milk, pumping and storage habits, and health and lifestyle factors that may affect the milk donation process. If the person passes the pre-screen, we ask them to fill out a medical history questionnaire and consent forms. We reach out to the donor's obstetric provider and pediatrician to ensure there are no contraindications to donation that may have otherwise been missed. And then we send the donor for a blood draw with a partnering lab. The milk pays for this test. As the donor moves from step to step, the donor screeners and the nurse continuously review eligibility. There are not many factors that would deem a person completely ineligible to donate milk. In most cases, we consider the milk itself and which factors would allow for it to be collected or not. It's important to note that many factors that we review are not necessarily unsafe for a donor and their own child, but for the recipient that may receive the milk. We cannot know which baby will receive milk and what their health history will be. Because our review criteria is continuously being researched and updated, we do not publish a definitive list of criteria. Instead, we review each donor and their circumstances on a case-by-case basis. But there are some factors to keep in mind when a person thinks they may wish to donate. These include results from blood testing, which are specifically HIV, hepatitis B and C, syphilis, and HTLV, and we screen for any active illnesses that may affect the milk. Many of you might be wondering about COVID-19. Nicole is going to provide more information about COVID-19 in respect to safety in a little bit, but in short, we can safely accept milk from donors that were affected. But if a donor has symptoms or screens positive, we ask them to refrain from dropping off milk until the end of their 14-day quarantine. And there are only a few donor restrictions due to travel, most of which revolve around potential exposure to variant Creutzfeldt-Jakob disease and Ebola. You may have heard previously that we did not accept donors who had traveled to some European countries like Poland and Germany. However, we're really happy to report that these restrictions have been lifted. We also review for substance use, including alcohol, cannabis, and CBD, and we screen for medications and supplements. In addition to adhering to accreditation standards by Himbana, we look to Dr. Thomas Hale as a subject matter expert to guide decisions. The good news is that many medications and herbal supplements are approved. Some examples of medications that are approved are ibuprofen, injected insulin, and the COVID-19 vaccine. Those that aren't approved are given individual exclusion periods, for example, narcotics and live vaccines. We always review pumping and storage techniques with the donor. For more information about pumping, cleaning, and storage, we recommend you visit the CDC's website. Summer can provide that link in the chat. And you can also visit our website for specific requirements. But I will share a few main points about storage. Again, please note that our requirements are specific to milk donation. They do not address handling of a parent's own milk for their own child. So for milk donation, donors must move milk from the fridge to the freezer in 4 days or less. And milk must be in a single-use container specifically made for breast milk, such as a breast milk bag, snappy bottle, or syringe. Best practice is to not mix temperatures, like adding freshly pumped milk to refrigerated milk, and it's best to store milk from only one pumping session in each container. Lastly, it's best to write the date pumped on the container, not the date that it was frozen. After a full chart review, the donor team can assign a donor number. We will determine any exclusion dates for milk that we cannot accept, and we'll give instructions on how to prepare frozen milk for drop-off at a milk depot. We'll stay in touch throughout the time that people are donors so that we can continue with ongoing screening. Parents can donate for up to 2 years after delivery. Next, Nicole is going to walk you through our depot network.
All right. So milk depots are designated sites where approved donors can drop off their frozen breast milk. These sites make it easier for moms in their community to donate and also safeguard our donor human milk supply for families and babies that need it most. Currently, we have 25 milk depots in Wisconsin and 34 in Illinois, and they are scattered throughout the state, which you can see in the map. Donors and providers can see where their nearest milk depot location is by using our milk depot zip code locator, which is located on our website. And Summer will actually provide that link in the chat box as well. So who can partner with us as a Milk Depot? Facilities that have a healthcare professional on staff can partner with us. Examples include health departments, WIC agencies, hospitals, pharmacies, lactation centers, and also breastfeeding clinics. And becoming a depot is fairly easy. A freezer is the only piece of equipment needed to become a depot. If anyone is interested, feel free to send me an email. It's on the screen there. I'd be happy to send you our depot toolkit and answer any questions that you have. So we work with our depots to transport the milk to our processing facility here in Elk Grove Village. Once milk arrives, this is the process that it goes through. So the first step is to test for bacteria in our in-house microbiology lab. And we are testing for a certain type of bacteria that is not killed during pasteurization. And at this step, we are testing each mom's milk individually. So once we get the test results back and the milk tests negative, we start pooling the milk. We batch our milk by pooling 3 to 5 donors together, and then we stir with our overhead stir, which is pictured there, while we are dispensing. And both of these steps are for nutritional consistency. Next, we are dispensing into the bottles, which you can see on the left, and then we seal the bottles. And then we pasteurize. So we use the Holder method, which is a long time, low temperature method of pasteurization, which kills bacteria and viruses, but is gentle enough on the milk to retain a lot of the wonderful properties found in human milk. And then the last step is to send pasteurized samples to a third-party testing facility to ensure safety. We also perform drug screening on our batches. So we use forensic kits to screen for 6 common drugs of abuse, which are listed on the screen there. The kits utilize a highly sensitive competitive ELISA assay. Results actually validate our thorough donor screening process. And to date, we've never had a positive result since the implementation of this program. So this chart shows the effects of pasteurization on donor milk. We always know that mom's milk is a first choice when available, but when it is not available, donor milk is a great alternative. So the Holder pasteurization method is the ideal way to treat donor milk due to the retention of many bioactive factors, including 100% retention of human milk oligosaccharides and high retention of secretory IgA antibodies. And a very relevant topic right now, COVID-19 and donor milk. So there are several reasons why COVID-19 is not affecting our milk bank process. First, there is no evidence that COVID-19 is transmitted through human milk. Also, a study by Salvatore found that COVID-19 was not found in donor milk or on the external surfaces of bottles. And then COVID-19 is totally inactivated by the Holder method. We are confident that donor milk is safe during COVID-19. And as Ginny mentioned before, we do screen for COVID-19 during the donor screening process. And this supports the public health mandates of social distancing. Summer will provide some links in the chat box to some resources about donor milk breastfeeding and COVID-19. There will be resources from HIMBANA, the CDC, the Academy of Breastfeeding Medicine, and also the American Academy of Pediatrics. So human milk protein, antibody, and fatty acid profiles change over the course of lactation and are affected by prematurity. Knowing this, we batch milk by developmental stage to capture the highest levels of protein and antibodies for our tiniest patients. Specifically, preterm and early term are prioritized for the NICU and special care nursery. Both of these are pumped within the first month and have higher levels of protein and antibodies. On the other hand, we also have term milk, which is pumped from that 1 month mark up until baby's first birthday. Term milk is used more widely and is dispensed to NICUs, special care nurseries, and mother-baby units. So we perform annual nutrition testing on each of our milk types, and we provide this information to all of our partnering hospitals. So where does donor milk go? I mentioned before that about 75% of our milk is dispensed to hospitals, and the other 25% is available for outpatients. And this is either through our dispensaries or through the milk bank directly. So I'm going to start off talking about donor milk in the hospital setting, and then Ginny and I will provide some more outpatient information later on. So here are the most common reasons why hospitals choose to use donor milk. A big reason in the NICU is that donor milk reduces the risk of necrotizing enterocolitis, also known as NEC, and this is an intestinal condition. It's most commonly seen in preterm infants. It can be very fatal. Donor milk also provides antibodies and other immune properties that are not found in formula. And local nonprofit milk banks provide local antibodies. And they will fight against illnesses in our geographical area. Antibodies may also help the microbiome and help with immune programming. And establishing a donor milk program can reduce healthcare costs and increase patient satisfaction by providing more parental feeding choices. Well-known organizations like the American Academy of Pediatrics, the Academy of Breastfeeding Medicine, and also the World Health Organization all endorse the use of donor milk when mom's own milk is not available. So here are some example indications for using donor milk in the NICU. Donor milk can be used for any supplemental need, and hospitals can create their own donor milk criteria according to their facilities policies. So we've known for a long time that human milk saves lives in the NICU, especially when we talk about NEC. And here are multiple studies that show improved outcomes with the use of donor milk in regards to NEC. And the study by Boyd found that donor milk reduces the risk of NEC by 79%, about 79%, which is big. And donor milk can also be used on the mother-baby unit. And here are some example indications taken from SEN's study. Donor milk use in the mother-baby unit is actually on the rise. We are seeing an increase in hospitals expanding their use from just the NICU to the mother-baby unit, and also birthing hospitals setting up their own donor milk programs. Having donor milk on the mother-baby unit increases feeding choices when medical supplementation is ordered. So you are giving families a choice. And when supplementation is ordered, either for donor milk or formula, it is critical to support mom's breastfeeding supports. Having donor milk available is also associated with higher breastfeeding rates at discharge, which was reported in Belfort's study. And also, if hospitals track exclusive breast milk feedings for the Joint Commission, donor milk is classified as breast milk. So the Milk Bank is happy to assist hospitals establish donor milk programs, which is what I do. I'm always happy to help. And here are some quick highlights about donor milk programs. So a donor milk program may be an extension of your breastfeeding policy. The preparation, storage, handling, and fortification are similar to mom's own milk. The only difference is that thawed donor milk can be stored in the fridge for up to 48 hours versus 24 for mom's own milk. And this is because donor milk is pasteurized. Donor milk may be stored in the same freezer as mom's own milk as well. It can just be separated by a shelf or a bin. And we offer hospitals sample donor milk guidelines for the NICU and mother-baby unit to help with the transition. And from our experience, and with the hospitals we serve right now, donor milk is often included in the room rate, and parents are not charged for donor milk when it is part of a nutrition program. If anyone is interested in setting up a donor milk program at your hospital or birth center, send me an email. I'd be happy to answer any questions that you have and to send you an individualized hospital toolkit. And as I mentioned before, about 75% of our milk is dispensed to hospitals, and then the other 25% is available for outpatients. And one way that families can access donor milk is from one of our donor milk dispensary locations. So donor milk dispensaries are designated sites where families can access donor milk in the outpatient setting. Most dispensaries allow families to purchase the first 10 bottles without a prescription. And if they do decide to purchase more, Hembana requires a prescription. And the reason why is because we want families to have an ongoing conversation with their baby's provider about their feeding plan. And as you can see with the cost, donor milk is ideal for short-term supplementation. It serves as a wonderful bridge until mom's own milk comes in. It's not feasible for long-term supplementation for most families. And the price for donor milk from a dispensary ranges from the $18 to $21 per 4-ounce bottle, since they can compensate for shipping costs or transaction fees. And the price associated with donor milk is actually the processing fees. So no one profits from the distribution of donor milk. So currently we have 5 dispensaries in Wisconsin and 9 in Illinois. Outpatients and providers can view our dispensary location on our website's For Milk Recipients page, and Summer will provide that link in the chat box for you to view. I also wanted to mention the picture of our medical director, Dr. Ann Eglash. Her vision is to have donor milk just as accessible as formula, and we are working towards her goal with these donor milk dispensaries. So who can partner with us as a dispensary? Facilities that perform financial transactions and have a healthcare professional on staff can become one. Examples include hospitals, pharmacies, breastfeeding clinics, and chiropractic offices. And a freezer is the only piece of equipment needed. If you're interested in becoming one, just send me an email. Again, I'd be happy to send you a toolkit to become a dispensary and to answer any questions that you have. Next, Ginny is going to talk about accessing donor milk from the milk bank directly.
All right, so like Nicole mentioned, dispensaries are great options for families that need smaller volumes of milk, like 5 to 20 bottles. And dispensaries are also good options for those that live very close to a dispensary and who will be paying out of pocket. For some families, we recommend ordering directly from Milk Bank WGL. We have an NPI number and are considered a durable medical equipment provider. Ordering from the milk bank is best for those needing high volume or long-term supplementation. An example would be a young infant with a GI disorder with no maternal supply. Milk that may qualify for insurance billing can also be ordered directly from the milk bank. I'll be detailing this more in a little bit. Inpatients that are hospitalized in a NICU or PICU without a donor milk program may also access donor milk from us directly. And lastly, families that live far from dispensaries may benefit from having milk shipped directly from the milk bank instead of making long distance trips to a dispensary. Interested families should fill out an outpatient interest form on our website. It'll be that same website that we just put in the chat. And once we receive the form, a staff member will talk with the family directly to determine feeding needs as well as insurance billing eligibility. We will work with the family directly to collect paperwork, coordinate orders, and take payments. We require a prescription from the child's pediatric provider, and we provide an order template along with the paperwork for this. If we will be billing insurance, we may also ask for additional documentation to support the medical need. So I've listed here a long list of some indications that are common for outpatient donor milk usage for those under 12 months old. We most commonly receive requests for delayed onset of lactation, failure to thrive, low blood sugar, and formula intolerance. And of course, many families choose donor milk because they want it for their baby. Human babies like human milk. And just like milk donation, the use of donor milk is a very personal decision. No two stories are the same, and there's no wrong way to use donor milk as part of an infant's diet. Most families request donor milk because they are seeking a particular therapeutic benefit from milk. The child may have a discrete medical need, such as necrotizing enterocolitis, sepsis, or heart disease. And at the bottom of the slide, you'll see a premature baby next to a healthy toddler. This same child received exclusive donor milk for months, resulting in a successful transition from hospital to home and a healthy growth into toddlerhood. Some families may use donor milk to supplement a baby's formula diet, especially in order to get antibodies. They may use just 1 bottle a day. This may be a good option for parents with a partial supply, babies that have been using formula, or adoptive families. And some babies may have formula intolerance, necessitating an exclusive human milk diet. Again, you can see that there's a lot of ways to use donor milk in the home. The therapeutic reasons that parents choose donor milk reach well beyond this list, and the personal reasons that parents choose donor milk reach even further. Humans benefit from human milk in ways that we can't always fully understand, and for this reason, many people develop a deep preference for human milk, believing that it is the perfect food for their babies. Or parents may otherwise wish to avoid additives in formula. And the last reason that parents come to the milk bank is because they choose to. For those that wish for it, we offer donor milk as a choice for any baby's diet. So we will provide instructions for how to use donor milk. The process is very similar to using one's own milk at home. Frozen milk can be thawed in the refrigerator or in a warm water bath, and a microwave should never be used because it could destroy some of the nutritional properties of milk and may cause hot spots. Milk is transferred into a bottle for feeding, and the remaining thawed milk can be stored in the fridge. It can be used within 48 hours of thaw, and as Nicole mentioned, it lasts longer in the fridge than raw milk since it is pasteurized. So next I'm going to detail the insurance billing landscape in Illinois, and then I'll discuss how we can work with families in Wisconsin. We are incredibly proud to have fought for insurance coverage of donor milk here in Illinois. This bill, which is Public Act 101-0511, protects families that require donor milk for a clinical need. In the picture, you can see the bill's chief sponsor, Representative Katie Stewart, receiving an award from Milk Bank WGL for all her advocacy and dedication. We also shared an award with Senator Crow for her support as well. And at this time, we wanted to thank the Coordinated Youth and Human Services, CYHS, and Granite City for hosting this luncheon to honor their work. And with their leadership, the bill passed in the state and the Senate, or I'm sorry, the state Senate and the House, and it became law on January 1st of 2020. The act itself amends 3 Illinois statutes, which are listed above. And this bill applies to all Medicaid and MCO plans, as well as many commercial plans. However, the requirements may not be applicable to some self-insured employers, employee benefit trusts, and other ERISA exempt organizations. So there are 4 factors needed to qualify for insurance billing. Milk must be obtained from a human milk bank that meets quality guidelines established by Himbana. That's us. We're the only milk bank in Illinois that provides this service. And next, there must be a maternal factor. This may include inability to produce breast milk, such as after a mastectomy or from adoption, insufficient milk production, or contraindication to using the parent's own milk, like HIV infection or the use of certain medications. Then milk must be determined to be medically necessary for the infant. This must be evidenced by the provider order, a diagnosis, or medical records. And lastly, 1 or more clinical factors must apply for the infant. These clinical factors are very specifically outlined. For babies 0 to 6 months, it includes birth weight less than 1,500 grams, several critical conditions that are listed, and a general category of other serious or acquired condition. This last bullet point offers flexibility to providers in prescribing donor milk. Our staff can help to determine if the patient's situation will qualify for insurance billing. Some conditions that have fallen into this category have been neonatal abstinence syndrome and cephalic disorders. For babies aged 6 to 12 months, those with birth weights less than 1,500 grams must also have a long-term feeding or GI complication. Some criteria are no longer relevant that were in the 0 to 6 month category, and 1 condition is added, spinal muscular atrophy. This is a neuron muscular disorder, and among other things, it results in a fatty acid oxidation disorder that renders donor milk an optimal source of fat. Some patients with this condition have successfully been using donor milk for years, well after the age of 1. After the age of 1 year, we can continue to bill for donor milk for patients with spinal muscular atrophy, but this is the only one that we can bill for in Illinois. If we determine that the patient meets these 4 criteria, we will move forward with the billing process. We will help determine benefits and eligibility. We'll submit paperwork for a prior authorization, and we'll submit the claim. Along the way, we'll help reconcile any deductible payments, co-insurance, or balances. For any questions about insurance billing, you can contact me directly at the email there on the screen. So what about Wisconsin? At this time, there is no law to require coverage of donor milk in Wisconsin, but rest assured that we fought to support Illinois families, and we will be doing the same for Wisconsin families. If a patient has a clear medical need for donor milk, we will bill insurance. We will use the Illinois clinical criteria as a guide. And since all plans vary and because there is no law, we cannot guarantee coverage of the donor milk. But we also recommend that recipients reach out to their health care plans as well, because there is strength in numbers. And then lastly, I wanted to mention that TRICARE, which is a military plan, does cover donor milk in both states, so both Illinois and Wisconsin. They use similar clinical criteria as Illinois, but they also allow for coverage for formula intolerance. However, they only cover milk up to the age of 1 year. So if at any point it appears that the patient is not eligible for insurance billing, we will discuss payment options with them. If needed, we can help set up a payment plan or consider charity care. Our charity care program supports access to donor milk for those that demonstrate financial need. We invite anyone to fill out a charity care form if they would like to. We review family income, family size, and any other financial or medical factor. Based on the application and available resources, we can offer a discount to families for that outpatient milk. Some circumstances when patients have qualified for charity care have included low income, high medical costs, chronic illness, hospice, maternal illness or hospitalization, or maternal death. When there is a maternal death, we universally offer a minimum of 3 days worth of milk for the newborn. This is one way that we can honor the families and the best way we can offer with the gift of milk. In addition to this service, we are dedicated to providing bereavement support to families after pregnancy or infant loss. And Titina is now going to share some information about our bereavement program with you.
Poppy's Dream Bereavement Program. Our bereavement program supports families that choose to donate milk in the honor of their baby. This is the heart and soul of our milk bank, and we are very passionate about working with these families. Hand-painted stars each carry the name of a baby whose milk was given to nourish others. Families are invited to hang their star. We hold candle lighting events every year. We also participate in various groups and committees related to palliative care and bereavement. It's a really beautiful sight to see. It's like a whole experience to walk up to the mural. Donor milk equity. I'm just going to emphasize the importance of equity based on everything that you heard my milk bank sisters talk about. Yes, they are my sisters. We are family. We are a milk bank family, and they adopted me, and I appreciate that. We define donor milk equity as equitable access to all milk bank services, donating, receiving, bereavement program, and community engagement. Milk Bank WGL has an equity lens to guide their work. Donor milk equity is health equity. Titina Sanders Bay, CLC, quote from me. The Chicago Donor Milk Equity Program. We have to give our brothers and sisters in Detroit some love for showing us the right way of ensuring safe donor milk access within the community. In 2015, the Black Mothers Breastfeeding Association sent an open letter to Medilac Laboratories, a for-profit entity that targeted the African-American community, to remove milk and sell it to out-of-state hospitals. No community voices were used in Medilac's decision, and they falsely claimed that it would increase breastfeeding rates and create additional income for breastfeeding families. Community lactivism overturned Medilac's plan, and Detroit moms kept their own milk for their own babies. Moms in Detroit that are interested in donating can contact the Himbana Milk Bank in Kalamazoo, the Bronson Mothers Milk Bank. This experience helped mold the Chicago Donor Milk Equity Program. We engage, partner, collaborate with, and serve the community. We support breastfeeding, we support families, and we plan to bring donor milk back into the community. The Chicago Donor Milk Equity Project is a collaboration between the Mother's Milk Bank WGL, the Illinois Public Health Institute, and NOHE, Nutrition, Obesity, and Health Equity Research Group. iSpan is a 5-year initiative to implement physical activity and nutrition interventions in low-income, rural, and communities of color, where the burden of chronic disease is high. One focus of our project is to increase community support and the continuity of care for breastfeeding in low-income and communities of color in Cook County. We have a little video that Summer can place in the chat for your review. The way we got the grant is we partnered with two professors from DePaul University, Dr. Tracy Lewis Elegant and Dr. Michelle McKay, strong advocates, and I'm very pleased to meet them and have them a part of the Milk Bank family. The grant purpose is to establish a milk depot on Chicago's South Side to facilitate milk donation for moms who choose to donate, removing geographic barriers to donation, and provide donor milk at no charge to ensure milk comes back into the community. This included 25 gift packs with education, resources, gifts, and donor milk. And we also connected families with resources such as WIC and peer counseling services. Barriers currently affecting donor milk. Yay, it worked. Social determinants of health, racism, and COVID-19. All of these are pretty self-explanatory, and they expose major disparities. Chicago's milk depot deserts. Depot locations are the blue markers. We have depots by Lakeview, Belmar-Cragen, the Medical District. Nearby suburbs include Oak Park, Berwyn, and Oak Lawn, Olympia Fields. We have received requests from the community to establish a milk depot on the South Side to make it easier for moms who are interested in donating to drop off their milk. Out of 6 hospitals providing OB services on Chicago's South Side, 3 OB units have closed since 2019 or plan to close. Several NICUs on Chicago's South Side and West Side do not use donor milk in their NICU. This is consistent with the report from the Center of Disease Control, CDC, that shows that babies born in zip codes with a higher proportion of Black residents are less likely to receive donor milk. On Chicago's South Side, where there are several underserved communities, there is a donor milk desert. And this is so important because these same donor milk deserts have the highest infant mortality rates. These babies need donor milk, especially the preterm and low birth weight babies in the NICU. According to the CDC, according to the Illinois Department of Public Health, December 2020 infant mortality report, Illinois has a long-standing racial disparity and infant mortality. Across all the years during 2000 to 2018, Black infants had an infant mortality rate 2 to 3 times as high as white, Hispanic, and Asian Pacific Islander infants. Infant mortality is the death of an infant before their first birthday. Preterm and low birth weight are 2 primary indications for donor milk use in the hospital. Some of the strategies that we are using to address the equity is partnering with safety net hospitals to help them set up donor milk programs to increase access in low-income communities, discount programs for the hospital, partnering with FQHCs, some of our outreach activities include getting our ducks in a row. So we do community engagement, we do community education, we do healthcare provider education, panel discussions, town hall meetings, webinars, and most recently, virtual gatherings. We were honored to present at the African American Breastfeeding Network screening of Chocolate Milk, the documentary, in Milwaukee during Black Breastfeeding Week. You can see that this was before COVID because you can see our smiles instead of seeing masks. After the pandemic, we partnered with Molina Healthcare to distribute information on donor milk options at multiple hospital baby showers, including St. Bernard and Advocate Trinity Hospital, which is baby friendly. These are some of our other long-standing community partners. We are grateful for the important work these organizations do in Wisconsin and Illinois. Equity work expands outside of Chicago and includes Milwaukee, other large cities, and rural areas where the lack of healthcare services impact health outcomes. We work together. We become the village. These agencies all have life-changing abilities that both families and providers can benefit from. If you see a logo that you don't recognize, look it up and learn more about them. The Himbana Equity Committee. Our milk bank is passionate about donor milk equity, and we are implementing actions at a national level. Himbana has taken the initiative to build an equity committee. Actions are in place to implement uniform equity standards for Himbana milk banks. Objectives include recognizing that health inequity exists and is perpetuated by systemic racism. Equity is and will be addressed in the following areas: community outreach, HR policies, recipient experiences, hospital policies, and advocacy. And the picture is at the USBC, also before COVID, when we can touch and love on each other and smile together. We were at the United States Breastfeeding Committee, and we met with stakeholders from other Himbana milk banks. A lot of us just met on that day, but you can't tell because it's like a family feeling. Moving forward, we have some things to celebrate. We are excited to fulfill a long-term goal with the addition of our new bilingual donor screener, who will help us communicate with Spanish-speaking families and also translate our educational materials and forms. We will continue to establish community partnerships, participate in research, seek funding opportunities, and most importantly, we will continue saving tiny lives on the daily. We are grateful for everyone on the webinar today, whether you work in WIC, a clinic, hospital setting, community setting, or academic setting. Thank you for spending time with us and learning about your local nonprofit milk bank, WGL, in Elk Grove Village. We serve Illinois and Wisconsin. Here is our contact information, but I'm about to, don't leave yet. I'm going to pass the torch back to Jenny. She has some stuff to say.
All right, thank you again. We have our information here to contact us. You have Nicole, Titania, and my emails, as well as the info@milkbankwgl.org email. Please check out the post-webinar survey. We will be sharing that survey in the chat. You're not required to do the survey, but we would appreciate any feedback you could give us. And also, if you would like to be entered into the raffle, go ahead and fill out that survey to be entered. The raffle prize, again, will be a $25 gift card and some swag. We also, as Titania mentioned, we are submitting an application for continuing education recognition points. It's been submitted to the International Board of Lactation Consultant Examiners, and an application for credits for CLC and CLSs will also be submitted. Everyone else will be offered a certificate of attendance, so watch your emails for those. And lastly, we have lots of time for questions. So if you want to put your questions in the chat, Summer is going to go through them. If there are some questions from within the presentation, she can share those and we'll all help answer them. And then if you have more questions, put them in the chat now. Oh, and one more thing, I forgot to thank our good buddies. Special thank you to the NOHE team at UIC for their support in planning and implementation of the webinar, and to Health Connect One for hosting the Zoom for us. Thanks again.
Hi, everybody. So now we're going to take time for some questions and answers. And I do have some that we've been accumulating that we can throw in the chat and discuss. And thank you for taking the time out to learn about milk banking today. We really appreciate it. So let's see here. The first question came through, and I'll post it in the chat right now. So this says, what materials are available to share with pediatrician offices and hospitals regarding the use of donor human milk? That's a great question. We actually have quite a few educational materials. So we have a how to donate flyer. We have how to receive donor milk or how to use donor milk for the outpatient setting. We have the Illinois Insurance and Medicaid fact sheet, as well as bereavement education support. So the best way, I'm going to put it in the chat right now, is to email info@milkbankwgl.org. And we can get any materials out to you guys in Illinois and Wisconsin. So we can mail them, send PDFs. We love providing education. So that's what we do here at the Milk Bank. We also have a good question about wanting to purchase breast milk as an outpatient. So do they need a prescription? And if so, what diagnoses are covered? And the question does give an example of a mom wanting to use donor milk as a bridge until her milk is in fully or until the need for supplementation is resolved. So we actually do not require a prescription if it's less than 10 bottles. So if the mom just needs a couple bottles, she can run out to one of our local dispensaries in Illinois or Wisconsin, or she could contact us. We are happy to help, and we don't require any type of condition. Right now, we have a great supply of donor milk, thanks to the generosity of all the superhero donors all throughout Illinois and Wisconsin. So we have a good supply. And we can provide milk to healthy babies as a bridge right now. So like Nicole said, 80% of the milk we dispense goes straight to the hospital, straight to the NICUs, but we do have supply for healthy babies as well. And let's see, we have some more really good questions here. Oh, this is a good one. What is the reasoning for limiting donors to 2 years postpartum to donate milk? So here at the Milk Bank, moms can donate milk up to the baby's second birthday. If it's collected in the first 12 months, we use that for hospital patients and for outpatients. If it's collected after the first year of life and before the second birthday, we actually segregate that milk and it's only used for outpatients. And the reason being is really the existing research looking at the macronutrients and the micronutrients in human milk. For a long time, Himbana Milk Banks actually limited it just to 12 months. And a study by Perrin's research group showed that actually the first 2 years is fairly stable with respect to the macronutrients and the micronutrients. So when more data is available, we will definitely consider changing our guidelines, but that's the rationale for limiting it to 2 years postpartum. So that was a great question. Another question, couple billing questions. So Julie, one of our friends from La Crosse, Wisconsin, reached out and she wanted to know, is billing for donor milk much different in Wisconsin? So we are, first of all, we want to let you know that we are here for you, Team Wisconsin, and we are advocating and working with legislators there in Wisconsin to hopefully roll out some type of formal coverage. In the meantime, our outpatient coordinator, Susan, can help, as well as Ginny. And if there's a child that has significant medical need, please reach out to us. We can bill insurance. We don't know if we'll be successful or not, but we also have charity care and other options to help Wisconsin families. And we have received generous donations from WALK. the Wisconsin Association of Lactation Consultants, who actually have helped fund our Wisconsin Outpatient Charity Care Fund. So thank you to WALK and to all of our friends in Wisconsin who make sure that we can reach everyone in Wisconsin and Illinois with donor milk. All right, let's see what other questions we have here. There were some questions about making connections. Please reach out to us. We'd love to establish more depots and more dispensaries. So thank you for reaching out. And I think I pretty much captured the questions in the chat. Let me just take a look here. Okay, so there's some more coming in. Let's see here. Yes, becoming a depot once all the craziness settles down. I like that. Please reach out to at least get the ball started or the ball rolling so we can work together to set up more depots and more dispensaries. And what information do you have about donor milk versus formula for newborn hypoglycemia on the mother-baby unit? If a newborn doesn't respond appropriately to glucose gel and donor milk, the NICU doctors usually request that we use formula for the next treatment. So I think that's appropriate. When you're managing hypoglycemia in the hospital setting, if you do use the gel, you're certainly going to want to look for a response to that gel. If you're not seeing the response you want, you can use donor milk. And again, if you're not seeing that response with donor milk, formula can be the next step, and then IV would possibly be the step after that. So we have different levels. Every hospital is different. Some hospitals would go from the glucose gel to the donor milk to the IV. Other hospitals maybe go straight from the gel to formula. Some hospitals are just using formula. So it really depends on the setting. There's not too much information about this. There's one study that showed kind of conflicting data. They actually showed that for term infants, donor human milk worked really, really well. It was a small study, so we'll just have to keep gathering more information. And I think it's good to have all of those options available, and all babies are different. Some babies may immediately respond to donor milk, and other babies may need a little bit more of a volume or possibly formula or an IV to really stabilize their sugar. So we definitely have to take it on a case-by-case basis. Let's see. Oh, La Rabida Hospital got some shout outs there. That's awesome. University of Chicago. So thank you guys all for chiming in. And here's another question. That's a great idea, Elizabeth. I like that idea. So any chance that these great links posted could be put into an email? I think that the team can get together to work on a post-conference email where we send a link to the survey again. We send information about the CEs that we're offering and also have all of those links back together. So here's a question: what evidence supports use of formula if donor milk does not sufficiently support blood sugar? So I don't really have evidence. That's just kind of a standard practice. And you raise a good point. So again, this is kind of a case-by-case basis. We want to correct that sugar, and it may be volume related. It could be, I don't have that data to show that formula is any more effective than donor milk. I think that every baby is different. And ABM, the Academy of Breastfeeding Medicine, has a really good hypoglycemia protocol that you can reference. This changes quite a bit. I've been a nurse for 15 years, and the hypoglycemia management has changed quite a bit throughout that last 15 years. There are some controversies surrounding this topic. I think donor milk is a great tool to have in your toolbox to use, and a lot of babies respond really well with donor milk. If it doesn't work, there's other options. So, okay, great. Let me open this up to the speakers. Did you guys see anything in the chat that kind of sparked anything? Did you feel the need to clarify anything that you talked about earlier? Or did you think that any of the participants, could use extra information or clarification about what you discussed?
Not that I can think of.
Okay.
Yeah, I know a lot of the billing questions are very individual, whether it's a specific location or a specific patient or a specific diagnosis. So definitely feel free to reach out to either our outpatient interest form or to me directly to ask, and I can help with that.
Yeah, and we want to have a part 2. So hopefully I'm speaking for the whole crew that we want to have another Meet the Milk Bank. And we can really dive into some more advanced clinical topics and maybe a little bit of molecular biology, which is my favorite topic. Talk about the microbiome. I'm really trying to share the biological perspective of using mom's milk and donor milk. And I think that touches on some of the questions, especially about the low blood sugar. What is normal from a physiologic perspective for newborns? And how can we use donor milk to support mom's milk feedings with really an emphasis on providing that direct lactation care for moms in the hospital? Because if you really look at this from a really big picture, supporting moms with breastfeeding is absolutely hands down the most important public health initiative that you can take for infant nutrition. Donor milk is, below that. So we're happy to be a little piece of the puzzle, like Titina said, and to help bridge gaps where it's needed. But let's get together and support moms to reach their breastfeeding goals, to really promote optimal infant health in Wisconsin, Illinois, and beyond. Oh, good. Someone's looking forward to a part 2. So we'll have to get started on that and really kind of dive into the microbiome, which is one of the cool things about donor milk is that we have all of those oligosaccharides. I mean, our donor milk is just completely full of human milk oligosaccharides. The formula companies would kill, they would die for what we have in the donor milk. They spend millions of dollars to put one human milk oligosaccharide into formula, and we have over 200 human milk oligosaccharides in the donor milk that we provide. This provides food for the good bacteria. It prevents bacteria, the bad bacteria, from attaching, as well as secretory IgA. I mean, how crazy is that? So when you think about donor milk, you're really thinking in a very broad, evolutionary context that mom's milk has been developing for millions of years. It's the ideal food for baby. We can take mom's milk and gently process it to provide it to babies in the newborn setting, in the outpatient setting. And then if we don't have access to either one of those, we can use formula as well. So yeah, so we're just a part of the puzzle. So awesome. Let's see if we have any more questions. And we still have 90 people on. Wow, thanks guys. This is so awesome. Okay, I think I gave a pretty good pitch for part 2. So hopefully we'll have 100 people at the next webinar to dive into more kind of advanced clinical concepts and more biology of human milk. And then if you have any questions, you can reach out to us anytime. General info can be emailed to info@milkbankwgl.org. Thank you for partnering with us. And yeah, I think that's it. So I will ask Marjorie, do you think that we should close, Marjorie, or do you think we should stay open for a little bit longer?
Up to you all. We could stay on for a bit if folks have other questions. I see someone's asking about access to the slides, which I think we can definitely do along with the recording. But if folks have other questions, feel free to stay on for a bit. Otherwise, if not, I think we're wrapping up.
Yeah, absolutely. And we could add that to the email. So we have kind of a list, a post-webinar email that we'll send out with links. We can attach the slides as well. And someone just asked about the links. We will have all of the links in the email. So in case you can't access the chat later. And thanks for the great feedback, you guys. And thank you. You guys are the heroes, all of the healthcare providers, whether you're working in the hospital or the outpatient or community setting, academics. thank you for taking care of patients, for supporting breastfeeding families during COVID-19. What a challenging year. Here's to 2021, to looking forward to, continuing our efforts to improve infant nutrition and to advocate for breastfeeding families and for all families. So awesome, thank you. Thanks for all the great feedback. You guys are great.
One thing I can add, Summer, is I know you mentioned potentially being able to give more information later about lactation and microbiology, but also we could potentially share more information about bereavement. So if any of you have some questions about a bereavement program, you can reach out, or we can potentially add that to a list of things that we can share with you all.
Oh, absolutely. I was thinking about that. Yeah, our bereavement program is so meaningful. And like Titina said, it really is the heart and soul of the Milk Bank. We have really comprehensive education that we provide to hospitals and to providers who care for families during perinatal loss, targeted to both the families as well as healthcare providers. What we're hearing is that families want to know that milk donation is a choice or an option. So we're certainly not recommending that every family who goes through perinatal loss donates. That's not at all what we're doing. We're about providing choices and education, and families who believe that that's the right choice can reach out. We have a very supportive program that walks them through every single step. And like Titina said, when you come in to our education and outreach center here in Elk Grove Village, and you walk into Poppy's Dream, it's really breathtaking and just so incredibly meaningful. You can feel the love as soon as you walk in. So we would love to talk more about that, to share resources about Poppy's Dream bereavement program. Oh, part 3, I like it. Okay, so part 2 is molecular and advanced clinical topics. And I think part 3 really should be dedicated to bereavement donation. We could even tie in some information about other Himbana milk banks and what they're doing to support bereavement families. Our bereavement coordinator, Susan, actually is the chair of Himbana's bereavement donation committee. So we're happy to share about this program and the impact that it has on families. Okay, well, I could definitely talk all day long about donor milk. So if there's a break, I can just, I can definitely keep talking. So feel free to throw questions in there. Oh, is there another question?
About sharing the recorded video.
I think so. Marjorie, do you have any input? Are we allowed to share the recorded video to coworkers that missed the presentation?
Yeah, I think normally what we do with the NOHE recordings is that we'll share them out to the listserv. We'll post them to our YouTube channel and invite folks to share them with their network as well, because we think the more the merrier. So unless anyone on the panel has objections to that, I would recommend that we do that again so we can get the word out.
Absolutely. Yes, feel free to share. Thanks.
I was also going to say, recommend peers or coworkers or bosses or doctors or anybody that you work with that you feel like could benefit from the information that we share, because we do individual organizations. Like, don't be afraid to reach out. Don't be afraid to present a new idea that you think might help in the long run in saving babies and improving the services that you currently provide for families. Even if it's just handing out, like, we have easy to read stuff, we have hard to read stuff. So you pick your battle and we can accommodate that. I like networking and engaging and communicating and learning. This was my first webinar to this extent on donor milk. And I've been doing birth work for a long time. And because it's so new, I was kind of nervous, but all I could do is be myself. And I'm glad to be in a position to make positive change for the community on behalf of Mother's Milk Bank of the Western Great Lakes and Himbana. Okay, that's all I got to say.
Thank you, Titina. And thank you for joining the Milk Bank family, as you said.
FANY.
And I feel like the Milk Bank family is really all of Illinois and
Thank
Wisconsin.
you, FANY.
Oh, Dr. Asadu is here. Hi, Dr. Asadu. That's awesome.
Thank you, Talika. Those are my homegirls. Thank you.
We have the best job, don't we, Titina? We are so blessed and so lucky to have such a great job. Oh, and I do have good news about, well, hopefully you guys have heard the great news about the COVID-19 vaccine, that a lot of professional organizations are supporting its use in pregnant and breastfeeding moms, with communication with the physician and the providers, of course. Here in Illinois, we had at least one, if not more, distressing cases where a breastfeeding mom was turned away from getting her COVID vaccine. This is a healthcare provider who presented to the public health department with an order for the vaccine with permission from her physician, and she was turned away. So we want to raise awareness about this. The Academy of Breastfeeding Medicine and other organizations support the use of the vaccine because this is a risk-benefit analysis. And so we just want to get the word out that the COVID-19 vaccine appears to be appropriate for use in pregnant and breastfeeding moms, of course, with that discussion and with counseling with their provider. So hopefully, there'll be some positive change and moms won't be denied the opportunity to get vaccinated, because that is a form of discrimination against pregnant and breastfeeding moms. They deserve to be vaccinated and protected as well. Oh, awesome. We have someone posting a link to our sister milk bank in Missouri. So there's the milk bank in Kansas City at St. Luke's, a beautiful facility. I was fortunate to visit them. Thank you, Elizabeth, for showing those organizations that support the vaccine for pregnant and breastfeeding moms. And I'll be presenting about the COVID-19 vaccine at the next state breastfeeding task force, the Illinois State Breastfeeding Task Force meeting. I'll be showing some cool pictures and cartoons about how the vaccine works. So that'll be fun.
Mm-hmm.
Okay, it looks like we're gonna close out. So I just want to take the opportunity to thank everyone for your time. Thank you for participating and learning about donor milk, about the safety of donor milk, the use of donor milk, and donor milk equity here in Wisconsin and Illinois and beyond. Thank you so much. And Titina, Nicole, Ginny, Marjorie, would you guys like to close?
Yeah, just thank you everyone for coming. This is certainly our favorite topic. So anytime you have questions, please call, email, reach out, share our posts on Facebook. We would love to talk with you further about it and help your patients and your community learn more. So, thank you.
And I'll say, you could have been anywhere in the world, but you were here with us, and we appreciate that.
And thank you, Dr. Odoms-Young. Thank you so much for helping
Oh.
us and for organizing this. We appreciate your support.
Thank you. It's just a wonderful webinar, and we look forward to just continuing to work with you. So very exciting. Great presentation.
Thank you.
Thank you.
Okay, great. So I will stop recording.
And thanks again to Health Connect